Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Here's what I bring to you from the world of medicine. Can eating more potatoes lower risk of heart disease? Study sheds light. A recent study published in the Journal of Nutrition found that potato consumption moderately reduces the risk of all-cause mortality and cardiovascular disease-specific mortality in adults. Potatoes are a staple food in many traditional diets, making them one of the most commonly consumed vegetables worldwide. They are a rich source of potassium, vitamin C, dietary fibers, and numerous bioactive compounds, all of which are essential nutrients that offer cardiovascular health benefits. However, despite these nutritional advantages, potatoes are often not recommended as a vegetable diet due to their high starch content. Their high glycemic index has been linked to an increased risk of cardiometabolic diseases. The latest Nordic nutrition recommendations suggest including potatoes in regular diet, but they do not provide specific guidelines due to insufficient evidence. Additionally, past studies examining the relationship between potato consumption and cardiovascular disease-specific mortality have yielded inconsistent results. In the study, a total of 77,297 adults aged 18 to 64 were enrolled. Participants underwent 3 cardiovascular health screening. During each screening, semi-quantitative food frequency questionnaires were used to gather dietary information, which helped calculate weekly potato intake and daily cumulative mean intake.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Study finds link between fish oil supplement and stroke risk. According to a study published in BMJ Medicine, regular use of fish oil supplement might increase the risk of first-time heart disease and stroke among those in good cardiovascular health, but may slow the progression of existing poor cardiovascular health and lower the risk of death. Cardiovascular disease is the leading cause of death worldwide, accounting for about 1/6 of overall mortality. Fish oil, a rich source of omega-3 fatty acids containing eicosapentaenoic acid and docosahexaenoic acid, has been recommended as a dietary measure to prevent cardiovascular disease. Although some epidemiological and clinical studies have assessed the effect of omega-3 fatty acid of fish oil on cardiovascular disease and its risk factor, the findings are inconsistent. In the study, researchers analyzed data from 415,737 UK Biobank participants aged 40 to 69 to estimate the association between fish oil supplements and the risk of new cause of atrial fibrillation, heart attack, stroke, heart failure, and death. They assess the progression from good heart health to atrial fibrillation, major cardiovascular events, and death. Their health was tracked using medical records until March 2021 or until death. Exercise might enhance the effectiveness of cancer drug, study finds. Researchers at the universities of Birmingham and Bath have found that a bout of exercise increased the number of anti-cancer immune cells, called natural killer cells, and that these cells were around twice as effective at killing cancer cells in ex vivo test carried out on blood sample from patients. The study published in Journal Brain Behavior and Immunity showed that the number of cancer cells present in blood sample transiently increased immediately after exercise, making them more susceptible to attack by natural killer cell and the antibody therapy. Previous research has shown that during an individual bout of moderate to vigorous intensity aerobic exercise in healthy humans, immune cell frequency in peripheral blood increases profoundly. Regular exercise may increase the body's immune response against cancer cell by increasing the number of anti-cancer immune cells, specifically natural killer cells. These specialized immune cells play a crucial role in identifying and eliminating cancerous cell within the body. Additionally, exercise has been found to improve the overall function of the immune system, creating a more hostile environment for tumor growth and metastasis. In the study, researchers worked with 20 individuals aged between 45 and 82 who had been diagnosed with chronic lymphocytic leukemia but had not yet undergone treatment. These participants engaged in a 30-minute session of moderate to vigorous intensity cycling. Blood samples were collected before and immediately after the exercise session, with a third sample taken an hour later. The researchers then assessed the number of natural killer cells present in the blood sample at each time point under ex vivo conditions. Additionally, they evaluated the ability of these natural killer cells to target and kill cancer cells, both with and without the presence of rituximab. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.